Hi, good morning, everybody. Welcome to the second day of the Science in the Newsroom Global Summit. We had a really good day yesterday, and we've got even more in store for you today. So thank you particularly to the cohort of learners from our Science in the Newsroom training this year and 2 years ago. We're really happy to keep you on a process of continuous connection with us, and hopefully you'll find today's session of huge value. Before we get going, I just want to say thank you very much to the funders, the Temasek Foundation. In them, we found a sponsor who agrees with our vision of uplifting skills in the newsroom and the value of that to society. So huge thanks to them for making it possible. And also to the International Science Council and Quest, who are our partners in making sure that the program makes sense and is fit for purpose. So thank you to Alison and Tamu and Stephen for your input there. Before we get going, just a little bit of housekeeping. There's a chat box at the bottom of the screen. Any questions you have, please just pop them in there and we'll pick them up and bring them to the attention of the moderator. And for the hashtags, we're using SCN20, Newsroom Science and Infodemic. I've popped them into the chat box. If you are going to tweet, please use that. It helps us draw attention to the work that we do. Right, it really is a pleasure to hand over to Alison Meston. Alison is the Communications Director for the International Science Council. She's someone who cares a lot about misinformation and worked, while she was at UNESCO, worked with me on the global handbook for fake news, for journalism, fake news and misinformation. And I'll pop a link to that in the chat box as well, in case you want to ever make reference to training for misinformation. It's a very useful tool for newsrooms and one you can share with your colleagues. So Alison, over to you.
Thanks, Cheryl. Thank you very much for that introduction. It's lovely to be back with the World Editors Forum and WAN-IFRA, so thank you for organising this timely discussion. Today we're going to explore some of the issues around the infodemic, or rather the disinfodemic, that we're currently facing due to the pandemic caused by the SARS-CoV-2 virus, and that's dominated our 2020, both in the way we live our lives and the news cycle. So just to tell you a little bit about the International Science Council, we're a non-government organisation with a unique global membership that brings together 40 international scientific unions and associations and over 140 national and regional scientific organisations, including academies and research councils. And most of you listening will have a member of the ISC based in your country, and some of you as journalists may be working quite closely with them to ensure timely information is provided to the public. Our vision at the Council is to advance science as a global public good. We believe that scientific knowledge and data and expertise must be universally accessible and its benefits universally shared. And I know these words will be of interest to our media colleagues because these are the same words used to encourage freedom of expression, that information and the right to share is a foundation for knowledge, and it's access to information that makes the right of freedom of expression meaningful and helpful to societies. But what if we're accessing and promoting disinformation, whether it's unwittingly or deliberately? So while the scientific community is collaborating on an international scale to find answers to this crisis in record time, whether it's finding new ways to test for the virus or to understand it better to respond to the health needs of patients, or the development and the deployment of vaccines, it's not the same world as it was when the polio vaccine was being deployed 60 years ago. So today's session will explore countering misinformation, how you can make a difference, and we're going to hear from experts from the World Health Organization, science and newsroom editors on countering the infodemic. I'm going to introduce the speakers and then we'll go to our first speaker. So I'd like to introduce first Melinda Frost, who is the lead technical officer with the WHO. Melinda is currently part of the Translate Science team, which is the infodemics pillar of the World Health Organization's response to COVID-19. Melinda's really going to set the scene for us on the scale of the disinformation disorder that surrounds the pandemic. Then we'll hear from AbdelHalim AbdAllah, who is a crisis communications officer with the WHO Regional Office for Africa. And he joins us from Egypt, and he's leading the setup and coordination of the Africa Infodemic Response Alliance. Next, we're lucky to have Dr. Roberta Villa join us. She's a freelance health journalist and a science writer and she's joining us from Venice, Italy, where she is a research fellow involved in QUEST, which Sherilyn mentioned at the beginning, and that stands for Quality and Efficacy of Science Communication in Europe. Roberta will be discussing the critical issues in reporting vaccine breakthroughs. And finally, we have Kritika Goel, who leads WebQuoof, an independent fact-checking initiative of the Quint, an online news source for millennials in India. And these are the words from the Quint. It aims to make sense of the systematic chaos that is the world today. So we're looking forward to hearing from Kritika a bit later, who will critique how the Quint bolstered its fact-checking capabilities as an online news provider. So look, let's get underway. Let's get underway with the first presentation from Melinda Frost from the WHO. So Melinda, good morning. It's good morning in Europe. It's good afternoon for the rest of the world. Over to you. Thank you very much.
Great, thanks for having me today. Let me just go ahead and share my screen here. Okay, thanks. As introduced, my name is Melinda Frost and I work for the World Health Organization as a technical officer. So my job is really been to help to translate the science behind COVID-19 for a number of our different audiences, one of which is to work with our internal, the external media group within WHO to be able to send out our scientific information through various channels to our media partners. So I thought I'd spend today talking about how 2020, the 2020 infodemic is really going to permanently change the landscape between science and the media. So let me go ahead and start. So just as a perspective on what the way we're viewing things at WHO and how this has sort of changed the way we work, this is just one of many statistics that we have showing the increase in interest and increase in traffic in our different media channels. This one is just to show the web traffic since January, about a year ago. It's a bit convenient, I guess, in one way that COVID-19 started at the beginning of the year. It gives us sort of these clear statistics. And at the beginning of the year, we had sort of 4 million page views. And, just 3 months later, had 209 million page views. So you can see the increase in interest, obviously, with COVID, and it's indicative across our different media channels as well. So it created quite a bit more demand internally to WHO to get messages out quickly and clearly and transparently. So some of the other things that we always look at during any emergency is sort of where our audiences are really seeking their trusted information resources. And it's really important that we're looking at what is considered to be trusted information resources. So this is a recent snapshot from the Johns Hopkins University dashboard on where a number of different countries are seeking their information. And this is plotted according to, in the upper left, high exposure sources of information, yet that have fairly low trust. In the lower left-hand corner, this is low exposure and also low trust. Moving over to the lower right, we see media sources or information sources that have low exposure and also, but have high trust. And in the upper corner, this is what we're really looking for is organizations or outlets or information sources that have high exposure and high trust. What we know always is that health workers tend to be one of the most trusted sources of information. So you can see them plotted here in blue. I think for the media purposes, kind of what we're seeing that's of interest is that television remains one of the, of course, higher exposure media sources, but also fairly well high trusted. And we've seen this across region to region. So it's important to notice that. Whereas online resources, you see in the upper left-hand corner, while they have high exposure, tend to have a lower trust. So important to see that. And then you can see some other trusted sources, newspapers a little bit scattered there, but with lower exposure. So we look at where people are really seeking their trusted information resources, because we know that during emergencies, people are going to have a tendency to go back to the information sources that they trust to get more information. So viewership doesn't, from what we know, doesn't change all that much. And they just continue to go to the trusted information sources. So there's some other things that we know are challenges during all public health emergencies. And this is where we as public health experts try to bridge the public health context with the public context. And there's a couple of things that we know will happen during any emergency. Obviously, it's an urgent event that causes decision makers to have to make quick decisions on the fly for the health and well-being of their populations. There's often uncertain science, and you can see this play out in magnitude with COVID-19, a new disease. In the beginning, we really weren't sure how it was transmitted, where it was going, and so on. During an emergency, a public health emergency, there are always several surprises and setbacks along the way. It's largely, a public health emergency is largely contingent upon behavioral components of a response, right? When it comes down to it, the things that's going to change the direction of an emergency response will be individual behavior. While government, public health, Ministry of Health, Ministry of Emergency responses will have some impact, it's really down to often the individual families and so on how they're going to mitigate their or change their behavior in response to help improve the situation. There's often a lot of public anxiety and concern. Certainly you can see this around COVID-19. And then there can often be some potentially extreme public reaction. And again, you can see this as well when it comes to things like mask use and so on. And there can be a political context. I mean, this is usually the case, even if there's just an emergency within one nation, but you can see it playing out now on the global scale as well. These are things that we have studied and trained and worked with countries to help prepare for prior to COVID-19 for other emergencies. So these are the things that we know will always happen. Again, what we're always looking at, and we know to look at, is public risk perception. How are they viewing the emergency? How is it affecting them? What do they consider to be the most harmful side effects or issues around a public health emergency? We always know there's going to be uncertainty, and we know that we have to communicate that uncertainty as well. And that can be difficult when we're working with you, the media editors, that we don't have the exact answers all the time, but that we have to be very clear about what we know and what we don't know. Trust. This is the cornerstone of all of our communications, because if people aren't trusting what we're saying, what we're recommending, they're not going to do it, and that's not going to help the situation. If you go back to what I just said in the previous slide, it all comes down to individual behavior. So if individuals aren't trusting the recommendations that they're getting, then they're not apt to kind of follow those. And then, of course, continuous listening to our audiences and understanding the questions, the concerns, and how they're viewing potentially misinformation or disinformation. What we kind of anticipated, but maybe not to the magnitude, was the infodemic. I think maybe yesterday you heard from my division director, Sylvie Briand, who very much predicted an infodemic. So this is something that we've really been working with at WHO and really focusing a lot of our work on. And the way we're describing an infodemic is it's really a mass amount of information, during an epidemic, an outbreak. And some of it's good, Some of it's not good. Some of it can be misleading on purpose or not on purpose. But the important point is that it's really making it difficult for individual decision makers to find the information that they need to be able to make the decisions that they need to make in their daily lives. So this could be high-level decision makers, leaders of a response, national leaders, and it's decision makers in the home. So the parent that has to decide whether or not to quarantine their family, whether or not to travel, how to safely get groceries. These are decision makers too. So we've been trying to work hard at WHO to cut through that noise and really get information to individuals and to different sectors and different groupings of communities, and I'll talk about that in a minute. So what infodemiology has brought to us that we didn't have before is that it's enabled us to have better maps, so to speak. It helps us to have networking of maps of online communities. It shows maybe how online communities, sort of virtual communities, are structured and how they relate to other communities. And it kind of helped map sort of the conversation that's at least going on in social media. So these are some new tools that we have not ever had before in any other outbreak. So really enabling us to kind of see and understand and communicate in a slightly different way. So it's not that it's all online. However, this is providing us some insight that we didn't really have before. The other thing it's enabling us to do is to kind of, really focus in on a couple different target audiences. These are just some maps on how different generations are doing their information seeking behavior. And as I mentioned earlier too, we tend to know that people will seek information in a similar way. They'll look at the same trusted sources of information that they used prior to an emergency, during an emergency. So things like this help us better target information to different groups. In this case, these are broken out according to generation, and you can see that sort of Gen Z and millennials are tending to look at more online videos, online information sources. You can see sort of a shift with the millennials seeking more news sources online and so on. Whereas Gen X and boomers, you see their predilection a little bit more towards television, a little bit more towards radio with some online news sources as well. So we know where to go when we want to get to certain target audiences as well. As I mentioned earlier, one of the big things that we always look at during an emergency is individual risk perception. Where do individuals see themselves and whether or not they're at risk at all. So this is somewhere where media can really kind of help us direct information. So if we look at this kind of sort of flow chart here, in the middle part being the target, where we have the right level of risk to prompt recommended actions. So this is kind of the things that we think about as public health communicators, and it's sort of a different way to look at our audiences. In this case, on the left-hand side, you can see that we have individuals that are considered to be sort of maybe overly cautious. They perceive a high level of risk, but they're kind of afraid to participate in what are considered to be maybe low-level important activities, routine vaccinations, routine medical visits. So they're more cautious than they should be around the event. Whereas on the right-hand side, we have those that are a bit overwhelmed by the emergency, and they're a bit fatalistic. So they do perceive this high level of risk, but they're reacting in a different way. They're almost frozen. They can't sort of take action that they should take, and they have a low level of self-efficacy. They don't feel like they have the ability to kind of manage this. And then under them, the sort of under concern, those that perceive this as a low level of risk, they think it's going to be okay, and they're not as concerned, whereas they may need to be concerned. So we have to kind of measure all these different people and kind of get them more towards the center, where they understand the appropriate level of risk and the actions that they can take as individuals to help solve this risk. So this is kind of where we really need your help in the media, because we can only communicate so many different ways, and we really want to make sure that we have action statements in our communication that help individuals be able to take action to protect themselves. And so we have to shape these different messages for these different kinds of people to help them kind of move towards the center of that graphic. And the other things that we're kind of balancing here too is sort of the public perception of the risk at hand and the scientific technical expert sort of perception of the risk. And this always comes down to a couple different things. I mean, again, any emergency, you can kind of plot these different things. So the public, which are looking at things a little bit more on an emotional basis, they're looking at the issue about how catastrophic it is, what the individual outcomes are. Do they have control of the situation, or is the situation under control by somebody else? Is there going to be permanent damage, or is it just temporary harm? Is it affecting children? If it is affecting children or pregnant women, people will automatically be more concerned about an issue. Is it sort of have a voluntary exposure? Meaning, is it a public health emergency that I can take care of myself, putting my seatbelt on when I drive? Or is it involuntary and out of my control, COVID-19? And is it familiar, something we're used to? Not that flu is not something to worry about, but people consider influenza a fairly familiar disease. Or is it a novel threat? Is it a new disease like COVID-19? So you can see how these sort of balance of concerns on the public really, of course, got everybody very concerned. It's new, it's out of their control, there's a lot of unknowns and so on. Whereas scientists, technical experts, are really looking at things according to numbers. What's the severity? What's the prevalence of the disease? So we always have to kind of balance these things when we communicate the science to the public. And when I say the public, that means through you, the media. So these are, some of the things that we really have to focus on when we're scientists and understand what the concerns are of our populations so that we can communicate the technical information a little bit better. The other thing we're always worried about and always trying to focus on and clearly communicate is communicating uncertainty. And again, after 11 months in this, there's still a lot of uncertainty. I know you are reporting on this every day. So lots of unknowns, although we're getting more and more clarity every day, things change and that's a difficult thing to communicate. There's a lot of questions out there that we still don't know. How can we balance the needs of the economy and stop COVID-19? Is it safe to go back to work? When are we going to have that vaccine? When am I going to have that vaccine? Things like that. When is this all going to be over? So lots of questions that are still out there, still unknown. And we have to be very honest and open about what we don't know and what we're doing to find out as public health responders. So what we've always been trying to do, at least in our communication, I hope you sense this from WHO, is be very transparent and consistent in managing the uncertainty surrounding this. And that requires us to have very direct, explicit public communication about the uncertainties, what we don't know. And we found that the more you're transparent about the uncertainties, the more there's the ability to gain trust. So again, setting expectations that things are going to be changing a long time. There's a lot of things that we don't know, but we talk about the things that we're doing to find out those unknowns, and that we're consistent. We're consistent between our different sources of information, our online, our press conferences, our Twitter sphere, so on. And that when we do have discrepancies and new guidance, where guidance has changed, we explain why that happened. Why did the science lead us to make a new and different explanation? And when we don't have the answer, we have to be very just transparent about why we don't have the answer, but also about why we're making the decisions that we're making. The last thing I wanted to talk about generally was listening. And this is something that we've can be kind of difficult to do, honestly, at a global scale. We get information back, but again, it's not always sort of, well, we can get it aggregated according to regions and countries and so on, but we have to kind of pull it back up into global messages. And that's why we work so closely at WHO with our regional offices that have more of their finger on the pulse of what's going on in the countries in the region. And you'll hear from my colleague Halim a little bit more about how that's done in Africa region where he works. As an example of the types of listening we're doing at WHO, every week we get an Infodemic digital intelligence report that gives us sort of the drumbeat of what's being said in social and mass media. We do this right now, but this is about to change, I think, mostly in English and French-speaking social media, and we're going to expand that to other languages soon. But we also get information, again, from our regional offices that do their own social media listening. So these are just examples from the past week, you know, that the key findings of things that are coming up in terms of COVID spikes, continued discussion of vaccine trials, and the science disinformation information. So then some of the top questions, these are just reports that we get every week, have to do with testing questions, mass skepticism, vaccine data, and symptoms. When we're doing listening to, one of the things we've been focusing on is redefining what we consider to be communities. In the past, it was very much sort of geographic communities, getting out information through local responders to work with communities. And now we're beginning to look at more virtual communities. So groups of people that have something in common that can keep a thread of communication going. So this is an example of one of our youth network activities where we're reaching out to these different youth groups. And right now we're really doing some exciting stuff where we're doing co-development of information that can better target the youth, because believe it or not, I'm probably not the best person to be developing information that's really would resonate with somebody who's 20 or 19. So it's been great to work with them to get some wonderful ideas that will better resonate with that group. The other thing we've done that's been a little bit new in this response is primarily through our partners and our external, or my colleagues in our external communications department have really reached out. This is the work of a colleague of mine, Andy Pattison, reached out and working with different unique partners to get information out in different ways. So you can see in here, we have Uber, hotels, hotel companies, Disney, some fashion companies, Amazon, and so on, to just get information out slightly different ways. Again, where people are looking for their information or other things. Lastly, ways that we're just, again, trying to establish that regular drumbeat of building trust through our messaging. So always having sources linked to different services, acknowledging our uncertainty, transparency, ensuring that people have individual actions that they can take that we alter at regional and country level to make more relevant, easy to understand, timely, and we use multiple channels. And again, increase this dialogue so we better understand the questions and the concerns among our communities. I just pulled a couple quotes from some work of our close media partners with Internews and BBC Media Action on ways to help address the infodemic. So from my colleague, Ida Just, doing fact checking, reality checking, it's more than a health story, and reaching out to those individuals who need it the most. And through another colleague at BBC Media Action, recommendations from media to just be prepared, coordinate, and help audiences understand, have practical information, actionable information, and then to, again, really address rumors, mis and disinformation, to be careful about that in the reporting. So that's fairly quick overview of sort of how we're viewing that translation of science through to the media. So happy to answer any questions now or later. Thanks.
Thank you, Melinda, for that presentation. I think we'll look at questions towards the end. But before I bring in your colleague Halim to give a regional perspective, I wanted to ask you about the overriding goal for outbreak communications being trust. And trust is also a pillar for ethical journalism and quality editorial for the news media. And it's absolutely a pillar for science. Trust and transparency is key. Yet here we are living in a post-truth world where on one hand, if you have a mobile phone and an internet connection, you have the ability to access information, more information than ever before. Yet on the other, it can be difficult for the public to decipher what is information you can trust and what is misinformation. So I feel this is a confluence of trust in the WHO, in science, in the media, all under a backdrop of our 70-year-old international rules-based system being under stress. I'm interested to know what your coping mechanism is as an institution. And a quick follow-up question is, I love this idea that you're creating about redefining what a community is. and you're looking at a community and the online communities that exist, and you talked about bringing in young people, and that's something we may need to consider in this disinformation infodemic is how do we work with communities that are online, that are not so open to hearing about scientific facts and the data presented by scientists. So I don't know if you have some comments on that.
Yeah, well, I mean, you really touched on this issue of trust, which is, yeah, it's disconcerting and it's difficult. I think the way we're coping is to just continue with a regular drumbeat of factual information, explaining our recommendations, the changes in our recommendations as we learn more. We're a scientifically based organization. And then I think just trying to ensure that we get this information out through a number of unique channels. So the more people see it in through different channels, the more, and see WHO's name associated with that information, the more trust should be gained when individuals are going to different regular sources of information. Yeah, and then, you know, just even leading over into this idea of the way we look at communities, and we know based on even past outbreaks with Ebola, like we have to reach communities, right? That they have to be in the response, or we won't, or there will be no trust in the response. So it's a new spin on that sort of geographic communities, you know, meeting with individuals face to face and broadening it out to more virtual communities where we anticipate that we would see the same level of involvement and interest, and people that feel linked to the response, feel part of it, and therefore will better trust it because they're part of it. They have a decision-making role in that response. So, you know, I think we're going to learn, I mean, obviously we're going to learn quite a bit from this response. So, but we may not know everything for several years.
Well, I mean, we certainly don't know everything. And in terms of the science community, I mean, we know a lot more than we did back in March, but I mean, it's still changing and evolving. And I think this is the big challenge. This is why it's called a novel virus. It's new, and we're learning to cope with it, and we're learning how to talk about it and fight this infodemic war that we currently have on our hands. Halim, it's time to bring you in from a regional perspective. So let's bring you in and hear what the WHO is doing in the African region, and some of the exciting things that you've got planned for this next phase of the pandemic, which is really around vaccines. Over to you.
Thank you so much, Alison. And I think it was perfect to have Mindy speak first, because she really laid the ground on the work, not just Mindy and the entire EpiWin team that she's working with. They've really paved the way and trailblazed for us to be able to do the work that we're doing. So today I'm going to tell you about something that we're setting up in the African region called the Africa Infodemic Response Alliance. And this is a WHO-hosted network of partners composed of civil society organizations, intergovernmental agencies, and governmental organizations working together to respond to health misinformation. Before I tell you more about this, I think it's important to explain the rationale or the kind of science behind all of what we're doing, which is setting up this infodemic management framework that Mindy's team has worked on developing with more than 1,300 experts from different walks of life and different backgrounds, etc., earlier in April. And this infodemic management framework is, we can break it down into 4 main pillars, which is identifying misinformation, understanding where the information gaps are, and then communicating and simplifying the science and the knowledge around it, and then amplifying it, amplifying the correct information and the debunks of the misinformation, and then finally quantifying the impact of these interventions that we're doing. So what we try to do with with the IRA, or the Africa Infodemic Response Alliance, is to try to operationalize this this infodemic management framework. So we are building this network in order to be able to make sure that we can map out the different initiatives that are being done, because there's a lot of work that's being done by different partners, media agencies, fact checkers, etc. And one of the things that we're trying to do is to try and map out these different initiatives under these different pillars and build a workflow that enables us to be able to make sure that everybody's work is connected and we're able to actually achieve this goal. So far we have quite the number of engaged partners. So we have the Verified Initiative, we have UN Global Pulse, UNICEF, UNESCO, Africa CDC, US CDC, and IFRC from the operational agencies. And we are collaborating with 5 fact-checking organizations. Well, these are the biggest fact-checking organizations in sub-Saharan Africa, which include Africa Check, AFP Fact Check, Peso Check, Dubawa, and of course there's Medan. So the work that we're doing is really divided across. So the objective is very clear. We want to limit the spread of harmful health misinformation and disinformation in Africa. But how to do it, we're trying to focus on a few areas of work. So coordination is key. So identifying the different initiatives that are being done, harmonizing the work between them, both on a regional and on a country level is quite important. Then working on improving infodemiology research. So there's a lot of questions around research questions around debunking misinformation and how to respond to health misinformation, the impact of health misinformation, and all of that. So we would like to include implementation research in the work that we're doing. So I will talk more about that also in a second. And then advocacy. It's quite important for member states, for media outlets, for the general public to understand that this is a serious issue and we need to stop it. Of course, misinformation and disinformation is something that is across all different themes, and we have seen misinformation around elections. We've seen misinformation around global warming and environmental issues. But really, with health misinformation, it's really linked to the outbreaks and the influx of information around this. So the advocacy work that we do here is mostly focusing around making sure that people understand this is an outbreak and there is an urgent need to respond to the misinformation that occur after this outbreak or this pandemic or this public health event. And that would also include prioritizing it in the response in the Emergency Operations Center, in the Ministries of Health that are managing the crisis, and on a political level, on all levels. Country support, this is tailored country support that we're working with different countries. We're mainly at the moment working with Kenya, Nigeria, Angola, on trying to support them with mapping out all of these and implementing all of these different interventions. Finally, and this is Viral Facts, which is the initiative that social media response to the pandemic, and this is going to be the public-facing brand of the Alliance. So one of the things that we are trying to do here is to make sure that we produce really catchy content that enables us through different platforms that we will be able to So through different platforms, through social media, we will be able to respond to the different health misinformation using the support of the fact-checking organizations that we're working with. So why create a new brand? Like, we have WHO, we have all of these big organizations, we have the fact-checkers. Why create a new brand? We created this brand, or we're creating this brand, and this is something that's in the making. We're hoping to launch towards January. But at the moment we are working on testing the material that we're doing. But why are we creating this new brand? The main idea here is that we want to create a brand that would be a one-stop shop for everybody. It would be powered by all of these organizations and all of these agencies to make sure that the public and the partners have ownership of this brand. The type of content that we're trying to produce here is divided into three things. So we have explained. This would be video explainers, breaking down complicated public health issues. Then debunk. These are videos and GIFs and cards that would really respond to health misinformation through having these truth sandwich technique in debunking. And Get It Right, which is a misinformation literacy campaign where we try to pinpoint where exactly why the circulating viral content could be considered wrong or misinformation or disinformation, how for the public to understand these different techniques, what are the bots, what are how to distinguish between a misleading headline and clickbait and all of these different things. The different dissemination channels are, of course, Facebook, Instagram, Twitter, but at the same time, we really want to leverage the network that we're building from fact-checking organizations, collaborating with the media, and making sure that we amplify this work. Through WhatsApp, we want to also, WhatsApp is a closed messaging platform, of course. So one of the things that we're trying to do is to map out or create networks of influencers on a local level who are members of different WhatsApp groups, who people ask them for information, whether community leaders, micro-influencers, etc. And they would be able to have on hand the content that we produce from explainers to debunks to misinformation literacy content. So it would be easily disseminated through these channels. And we have a lot of work that we're doing on that front and established networks with UNICEF, the IFRC, who are core partners in this alliance. One thing that we did to try and make sure that this work goes smoothly and doesn't require a lot of heavy lifting when it comes to design and graphics, even though design and graphics and catchy designs are actually the core of what we do here, is that we have built this canvas or a very easy template on a Google spreadsheet that, as you can see it to the left, you can fill it in and plug it to After Effects, and then it becomes a story on its own. And we have, using the expertise of we have been engaging with colleagues from misinformation experts who have worked in that space for more than 10 years, and they have elections misinformation, as well as a lot of health and environmental misinformation. So one of the things that they're doing is that they are bringing this best practices in terms of the templates of what works to be part of this template design. So then these are some examples. One of the things that we have piloted is a video that we produced after the certification of wild polio eradication in the African region. We had anticipated that there would be a lot of confusion around that issue because there continues to be something called the circulating vaccine-derived polioviruses. And that's something that we have anticipated that might cause confusion, that there will be continuing outbreak response activities while we have announced that the region has been certified free of wild poliovirus. So we have created this video to respond to that and to debunk false and misleading claims. The idea here is that this video didn't come out of a vacuum. We tried as much as possible to, ahead of time, we had created these fact checkers briefing where we brief the fact checkers on the upcoming misinformation that we are anticipating, clearly identified the kind of possible confusions and all of this. So their debunks came in very handy and they were produced very quickly. And the whole idea of having this brand also mainly focuses on that, because fact checkers, they produce these amazing, very detailed journalistic pieces, but having this kind of engaging way of presenting the information makes it goes more viral and kind of competes with the misinformation, which usually spreads through graphics rather than through long posts or long texts. And here, as you can see, like this is an example of WhatsApp GIFs. We have designed also some templates for health quizzes for Instagram, more for WhatsApp. And the best thing about what we're trying to build here is that we're trying to make it easily, we can use different languages, not just English, French, Portuguese, Amharic, etc. And finally, the final point that I want to talk about is the impact. And we would like to make sure that we measure the reach. We quantify the impact of the work that we're doing through measuring the reach of how far does that content go, the engagement and people's reactions to it, the comments and all of that. But most importantly, on the social behavior. And again, that's something that that we really need to kind of invest in terms of research to understand what is the best way to actually connect the dots between all of these different things. This is a clear area where we need more research there. So I'm just going to conclude here and happy to answer any questions.
Thank you very much, Halim, for that presentation. And what you've done is given us an ambitious regional focus that has at its heart viral facts, and you're building on Melinda's points of trust in communication, but you're also asking local actors to identify, simplify, amplify and quantify the information around the pandemic. You're positioning Africa, I think, in a leading role around the next phase, namely a recovery phase for this pandemic. And your key word, I think, for me during your presentation was anticipation, that you're already anticipating what your communities, how they might behave. And that says to me that you know your communities well. And I guess what I'm interested to know is how are you going to be specifically working with news media on the African continent to counter the infodemic? How are you going to be working with local news to move these viral facts that you talk about further into the community?
That's an excellent point. I think one of the key things that we're trying to establish is this relationship and this network I mean, we already have through our external communications colleagues, and we do regular, almost a weekly press briefing to the media, and that's attended by a lot of media outlets from across the regions, Francophone, Anglophone, and Lusophone media, as well as from countries as well as regional pan-African. But one thing that we're really hoping to establish here is to include, and that's something that we've done with the fact checkers by including them as early as possible in the process. We want to have so we have a problem, and that's the whole idea of the alliance. We have a common problem. Everybody can see it. Everybody wants to solve it. What we're trying to build with the Alliance is to bring people together and think collectively and humbly about how to exactly to address this problem. So for viral facts, one of the things that we are hoping to do is to co-design our content with the local media. With local media, with journalism students, with the fact checkers and all of that. So these are the different types of content that I have mentioned, explained, debunked, and get it right. These are just headlines, and each community has their own popular culture references, and for something to really go viral and resonate with a specific community, we really need to kind of co-design it with the work. I come from North Africa, from Egypt, so I don't know what memes are being circulating in, for example, in Kenya or in Nigeria. So we really need to rely on the work and the understanding of local journalists and the design phase. And then we, in terms of, they also co-own they would also co-own the work that we're doing. And we want viral facts to be something that is co-owned by everybody who's contributing to it, not just the WHO brand.
Yeah, I mean, I think if there's one thing I learned in my time, well, when I was working with women in news in sub-Saharan Africa and also, in fact, in Egypt and in other parts of the Middle East, a program that WAN-IFRA runs, if there's one thing that I really learned is that local news really know and understand their community. So I think there's a lot of space for local news media organisations to be working with local WHO officers to co-design these programs. I'm concerned about the time, so I think rather than let's leave time for discussion at the end. So actually what I'd like to do now is bring in Dr. Roberta Villa to give her presentation about the research that that she's been doing around fake news and the way news media can involve the public in promoting verified science around the particular issues of vaccine science. So Roberta, can I ask you to present your presentation? Thank you.
Yes, of course. Thank you very much, Alison. Thank you, WAN-IFRA, for inviting me to this meeting that is very interesting for me. And I start with my presentation. I'm going to start from a case history, something that is very much debated today in these days in Italy. Is the case, because I'm going to talk about vaccines, COVID-19 vaccines. In these days, you know that many industries have started to communicate their preliminary results, and everywhere in the world, governments are preparing to distribute and deploy these vaccines. But there are also some fears and some hesitancy about this. And in Italy, we had a strong debate about the declaration of Andrea Crisanti, who is a very good and well-known scientist to whom science has dedicated a long story. And he said that at the moment, he wouldn't like to get vaccinated because he wants to see and wait for data, to see the data and to be reassured that that vaccines been tested and it's safe and effective. And these declarations evoked a very strong and harsh response by media and other experts and scientists. And because he was accused of feeding hesitancy and fears towards vaccines. And he answered with this article on the main Italian newspapers, Corriere della Sera, where he wrote these words that I think are key in our discussion, today's discussion. He said that transparency is a measure of your respect to others, and it creates a precious asset, trust. Transparency and trust are the two words that Melinda and Alison have mentioned as the pillars on which we can build our intervention to improve public health and to cope with this pandemic. And the problem is that pandemic is a complex issue. It's complicated, and very complicated is the issue about vaccines, because we have many vaccine candidates with different characteristics, created with different methods, approaches, very innovative techniques. We haven't had yet approved an mRNA vaccine before Pfizer and Moderna are now on the way, and there are many trials, and it's complicated. We cannot make this so simple as a white and black issue. on the contrary, especially in Italy, but I'm afraid that also in other countries, communication is going on this way. Communication is very, very simplistic. They say the message is vaccines work, vaccines are safe, without explaining that for vaccine as well as for other drugs, it's always a risk-benefit balance. And if we don't tell people this, we are in a very dangerous position, because any trial, no trial could ever rule out any possible side effects of vaccines that will be deployed to millions and billions of people. So we must be sincere. People have the right to know that we cannot rule out any risk, but we are pretty sure that when the vaccines will be approved, the risk-benefit balance will be okay. Transparency is also a key for planning, because of course, if you undervalue or oversee or don't consider the risk of side effects that can be not so severe, but maybe cause fatigue or fever, as it seems from preliminary data, but you say this is not a high fever, this is something not worrying. When you plan to vaccinate a full hospital, healthcare workers of one hospital altogether, you could face in the following days all your staff out of duty. So it's important to know how things are, to plan them better. And I think that journalists cannot ignore that this is a scientific issue, but it's also a political one. And the vaccine race is something very often compared to the space race, and that geopolitically balance is at stake. We cannot ignore this because we have to split things. We have to be very careful in splitting the geopolitical and the scientific issues. So we have to be aware of them before doing this. On the contrary, all over the world, I've seen it in Italy, but USA example is the most relevant. The vaccines, the COVID-19 vaccines, communication has been very, very much politicized and sometimes trivialized, as I said before, with a lot of hype. And when you hype a news, when you say that in January or before Christmas, vaccines will stop the pandemic and everything will go back as before, as unfortunately in Italy is being claimed by many stakeholders and many scientists or government representatives, this hype can unavoidably bring to distrust when people will see that it won't be like that, that we won't have so many doses for everybody in the first months of 2021, and that we don't know yet, as Melinda said, a lot of things. For example, how much this vaccine will be able to stop transmission of virus and not only the most severe form of the disease. So, as Melinda has already explained much better than I can do, when we communicate about vaccines, the main issue, the most important thing we have to remember is that the risks that kill people and the risks that alarm them are completely different. Our perception of risk is isn't the same as scientists can calculate with the prevalence or the severity of the risk. This is there's a rule that the perceived risk is made of hazards and of outrage. What makes a risk more or less acceptable? And I'm not going to go through this because Melinda explained this much better than me. The point is that the kind of communication we've had didn't improve the willingness to be vaccinated in many countries. We have seen it dropping in the USA, but also in Europe. We can see in this map, in the center of my slide, that countries very much hit by the pandemic, such as the Lombardy region where I live, or UK, are quite well prone to be vaccinated, but in other countries in Europe, this is much less. And also all over the world, as you can see, there are different approaches and different attitudes towards vaccination. And the only way we have to improve this is to improve trust, as it's been very well said before me. I think, and from some studies we've made in Ca' Foscari University, it's clear that the polarizing of the debate about vaccines is an easy way to feed misinformation, because, as much as a subject is polarized, as much fake news you can find on that issue. And this is easy to understand if you think that one of the most important components of fake news, of our attitude to believe in fake news, is confirmation bias. Is when we have confirmation bias that makes us believe what we want to believe. So if we are very much polarized, for example, in saying that COVID-19 is like a flu, we don't have to worry about this, we will be pushed to share and adhere to all the news that are in line with this narrative. On the contrary, if we are very much scared, we will be prone to spread all the most terrifying news and emotional news about COVID, even if it's not true, without fact-checking. So the most important, one of the most important things we have in counteracting fake news is trying to put out the fire of polarization. What can we do to help journalists to orient in this, and what's our challenge as journalists is to remember that in this pandemic, as Melinda's already said, we have to face even more than in other public health crisis, and even more than in science communication as a general, we have to cope with uncertainty, because we have a new virus that surprises us in many times, and with complexity, because the pandemic is not only an issue of health, is not only an issue of politics, is not only an issue of economics, but all of these together, and we have to remember this. So I just want to leave you with some take-home messages that trust is the key, and it can be gained only by transparency, as it's already been said, that journalists at their heart has communicate complexity and uncertainty, that everybody, even journalists, when interview scientists or politicians, they always have to ask for evidence. And another point that it's important to gain trust from the public is to show empathy for doubts and fears. I just put my book, Vaccines, the Right Not to Be Scared about Vaccines, but I put that note within brackets because I think that people have the right to be afraid of vaccines because this is normal, but we have the duty to help them to make more aware and make good choices and vaccinate themselves and their children, overcoming their fears. And at the end, avoid polarization, because I think that these black and white narratives are very, very much dangerous. And at the end, I want to show you some quality indicators for science communication that I think can be very well fit also for this crisis communication. These are the results of our work in Quest project, where we organized many workshops all over Europe with different stakeholders, and we tried to define quality. It's not easy, but we try to do this, identifying 3 pillars of a good science communication: trustworthiness, presentation style, connection with society, and try to decline this in different characteristics that each of us should check up when trying to communicate science, even in a crisis like this. That's all for me.
Thank you very much, Roberta. And again, I think we're seeing these themes coming through around trust and transparency, but the other issue that you've now brought in is the issue around polarization and the different kinds of factors that are around our society that weren't necessarily around 50 or 60 years ago when the polio vaccine was first introduced, or indeed the measles vaccine. And we know that there have been trust issues around that vaccine, for example, in Samoa a couple of years ago when we had the outbreak there. So there's a constant need to both have trust, but to recognise that communities might have reasons to be scared. Some of those issues might be based in, you know, long-term issues around colonialism and those kind of issues, or they could be simply now these communities that Melinda's spoken about, these online communities and echo chambers that exist you know, so for example, you know, where a person of trust in the community 50 years ago might have been a religious person getting their children vaccinated against polio. Now it might be an Instagram influencer speaking to 2 million people who follow their Instagram accounts. So I mean, I think there's a real need to consider those key messages around empathy and transparency and trust in this day and age. Let's bring in Kritika, who's been waiting patiently, and I think it's a really nice way to end our discussion because she's going to talk to us about her newsroom and her news magazine, or her online news is mostly for millennials. That's right, isn't it? Your audience is young people, Kritika, is that right?
Yes, Alison, that's right.
And how many people are we talking about? Do you have in your community, which is an online community, the type of community that Melinda would like to get hold of, I'm sure?
So ours is basically a digital news organization. And if I talk about the number of people that we have on Twitter, that's something around 598.2K followers. And we have a similar number of followers on Facebook as well. But yeah, as you rightly pointed out, we are mostly targeting millennials. And yeah.
Okay, well, look, I'm really interested to hear about the collaborations that you've been making in your newsroom to look at the facts around COVID. And in fact, one of the questions that has come in from Giannina Marcello is saying, you know, how can we as journalists debunk myths around COVID-19 and avoid misinformation? So I think your presentation is going to answer her question. So it's over to you.
Thank you so much, Alison. So actually, I want to pick up from what Dr. Roberta also said today. She was talking about confirmation bias, and that's something we witness on almost a daily basis while we're either whether we're talking about misinformation around COVID-19 or we're talking about misinformation around elections. But confirmation bias does definitely come into play when we're talking about any sort of misinformation and disinformation, because people tend to believe the information that confirms their pre-existing biases. And I just wanted to give a very small example of one such story that we saw in early March. That's when India had announced its first lockdown. Actually, before the lockdown, there was an unsaid lockdown. There was a Janta curfew. Just for people who don't understand what Janta curfew is, that was basically a voluntary lockdown of sorts that was announced by the Indian Prime Minister. So after the announcement was made, it was like a 14-hour long voluntary lockdown that was announced. People were out on the streets, and there were so many messages which were doing the rounds on social media, which said that India is going to defeat the coronavirus because the virus does not survive on any surface more than 14 hours. And since we were indoors for 14 hours, we're going to break the chain of the virus, and there's not going to be any sort of transmission. So, I mean, the reason why I'm giving this example is to show how misinformation, also because this is the time when we had limited information about the virus itself. So this is how people used that information to say that now we can go out on the streets and we've defeated the virus because we were indoor for 14 hours. So that's one of the examples that I just wanted to bring up, because Dr. Roberta really pointed out the right thing when talking about misinformation is confirmation bias. What I also wanted to talk about were the kind of patterns that we've seen around misinformation or disinformation. In fact, as you also rightly pointed out in the beginning, it was really a disinfodemic because it wasn't just information in abundance, but it was also a lot of misinformation and disinformation, which was not just spread on social media, but it was also spread by politicians. So it becomes really important for us to be able to combat this mis or disinformation, because when people like Donald Trump goes on to say that COVID-19 is nothing but it's just a flu, his voice is really, really amplified. So what is really important for fact checkers, for journalists today, is also to be able to produce content, to be able to do fact checks in a way which helps in increasing the reach of the content that we are producing. And again, that also brings me to a point that my co-panelist Halim had mentioned about producing content which can be shared further with your audience, with the community, with people, which is, I think, content which is basically shareable, which can be shared with people, which is easy to be shared, basically easy to be consumed and easy to be shared. So that's also one really important thing that we do in our newsroom, that we produce content, not just text pieces, but we produce content which can be shared with the public in the form of infographic cards, in the form of GIFs, in the form of videos, in fact, in the form of video explainers as well. Just to answer the question that a participant has asked, and as you mentioned, what can people do to fight misinformation around COVID-19? I think one important thing is to always question the source of the information. Where is that information coming from? Is that information coming from a verified a person? Is it coming from a verified handle? Is it coming from an organization that you can trust? Or is it just coming from a random WhatsApp forward? Now, also the thing with WhatsApp forwards is that, sometimes when you receive messages on WhatsApp, the trust level is sometimes really high because you're receiving it from your close group of friends and family. You might be receiving it from somebody who's really close to you. So you might trust that message because of that trust that you have on that person. That trust translates, I mean, that trust is carried forward to the message, because of which you might forward it to further, you might forward it to other people, but that message might not be true. And that is something which also happened in case of COVID-19 and the misinformation that we've seen around COVID-19. There was so much of misinformation. So if I could just go back a little, in early March, India reported its first case on 30th of January. And we had started doing fact-checking stories somewhere around in January, and that was a time when we were doing a lot of stories around how can the virus spread, and what causes the virus. So I remember we've done stories where there were messages and people were saying how eating ice creams and drinking cold drink can cause coronavirus. But we've also seen that the misinformation has, if I could use the word very loosely here, progressed. But how this misinformation has changed as the news cycle has changed. As came March, and when we in India, we had our first lockdown, it was announced on 24th of March by the Prime Minister. We saw more information, we saw more misinformation around what can cure the virus. Then we had these stories around how drinking hot water is going to help, how eating garlic or onion is going to help. But and then so on and so forth. Now we are seeing misinformation around vaccine. We've seen misinformation how vaccine is going to alter the DNA. We've also seen misinformation around masks, and I think that's something which is a global phenomena, where there are anti-vaxxers and there are anti-maskers who are talking how you should not take the vaccine, how you should not wear a mask, and it's just a flu, and it's basically a, a, a conspiracy, and coronavirus in reality is not as it's not as deadly as people are claiming it to be. So I think that is some kind of misinformation that we've seen around coronavirus, and how we've seen it progress with the news cycle, from initial days talking about what causes it to what can cure it, and now we're talking about the vaccine. I think I also wanted to talk about our collaboration. The reason being because I feel collaboration is really important to amplify the reach of fact-checking content. And as I mentioned earlier, it's important because this content that we're talking about, misinformation and disinformation, it's not just 2 or 3 people sharing it. It's really widely being shared. It's being shared on a wide scale. So I think it's important for journalists and fact checkers and this community to come together and work together. And that's something we've done, as it was initiated by IFCN, which is the international body for fact checkers, which sets the benchmark for fact checkers. Over 100 fact checkers across the world came together and we worked together, which was known as the Coronavirus Alliance. It made easier for us to reach our counterparts in other parts of the country, in other parts of the world, and be able to verify information. What we also are a part of is Facebook had launched a fellowship in October for health fact checking, to be able to deal with any future outbreak like the COVID-19, and the Quint's Webkuf were a party to that as well. We've closely worked with the health community. We've closely worked with experts. We've closely worked with the doctors and virologists to be able to understand this virus, to be able to understand, to be able to get the right information, and to be able to share that information with our audience. Because I think the information about the virus was so limited initially, and in fact even today there are so many researchers, there are so many studies which are going on, and so much there is still so much of information that I think we also always need an expert opinion. So we work very closely with the health community. We work very closely with doctors to be able to verify, to be able to put out 100% verified information for our audience, to make sure that the information which reaches them is absolutely true, it's verified, and there is no iota of doubt. I mean, of course there are stories where there are researches which are going on, and we ourselves don't know sometimes whether the information is true or not. In that case, we always put out the story saying that the research is underway, or if we are not putting out the story, we generally reach out to the person who's reached out to us to let them know that the information they're seeking, that's a research which is underway. I think what is important, as everybody else has also pointed out, is trust and transparency. You need to be transparent in what you're doing. You need to be extremely you have to tell your audience how you're doing it so that they can trust you, because anyway, with the vast amount of information around COVID-19 and so much of misinformation around COVID-19, it is really putting lives at stake. So yeah, I think.
Kritika, thank you for that analysis of what your newsroom is doing. And, we have about 10 to 15 minutes left. So I'd like all of the panelists to come and join the conversation by putting on your videos. And let's just use this time to have a look at some of the themes that have been raised. Kritika, I think one of the things that struck me is that, again, we talked about these new communities, and Melinda spoke about the community, the online community that she's creating from the WHO side of things. Halim talked about the communities that they want to create at a local level. Roberta has talked about the different kinds of trust issues communities have, and Kritika, you've talked about this new online info checking community through Facebook that you've been instigating. So I think one of the things that I'd like to discuss is, we haven't really enjoyed 2020 in terms of the way that we would normally enjoy a year. It's affected us in all kinds of ways. We have to manage expectations. And I think people don't realize, when you look at, for example, smallpox, which first started being inoculated against at the end of the 18th century and wasn't eradicated until 1980. So we're talking 200 years nearly. Everything now is happening much quicker, much more rapidly. And again, this reflects our society. Information comes to us much more rapidly. It used to be news is something you didn't know yesterday. Now news is something you didn't know a minute ago. And now we're not even sure if it's verified. So let's explore this a bit more. Melinda, let's bring you in. What have you thought of the conversation that we've had this morning, and how do you respond to these kind of issues that are being raised?
Well, let me start off by saying it's been an honor to be on a panel with Halim, Roberta, and Kritika. I mean, it's nice to see sort of our different aspects, but that we all kind of honed in again on the sort of same themes of trust and transparency and community. And you really said it right? Things are moving at lightning speed, and kind of go back to the beginning of my presentation, sort of some of the things we would always anticipate in a crisis, in a public health crisis, and some of the things that we were a bit surprised about. And again, the influx of loads of information is something certainly we would always have predicted, but the speed, the volume, the questions, and I mean, maybe to some degree, to maybe a little positive light, the interest. I mean, I think that this has enabled us to reach out to different people that might not normally stop and think about their own health, think about the implications of their health, their behavior on other individuals in their community, even think about how to communicate within their community and how to weigh in different things like mental health during all of this. I mean, I don't know if this is quite getting to your question, but I think there's some kind of underlying things that have been a bit more positive about COVID-19, and that we see globally how we're all connected. I have teenage daughters who, I think the teenage and young adult communities felt very affected in a different way than many of us.
Absolutely. Yeah.
And the one consistent thing I say to them is like, well, one thing you can be assured of is that you're not the only people that feel this way. They're feeling this way all over the world. So Yeah.
There's definitely been that shared experience, hasn't there, that we're together apart.
Yes.
I think it's shown that we have different vulnerabilities in that shared experience, so not everyone is experiencing it in the same way. But it also gives me hope when we have to look at future crises, particularly around climate change, that if we can make changed behaviour now, we can also make it for the future. Halim, what have you taken from this discussion, and what can you take back to your new network that you're hoping to move forward on the African continent?
I think it's quite comforting to know that we're all thinking in the same direction. I think all of the different, all my co-panelists have highlighted different, how we call it when it comes to epidemiology. We're trying to understand, we're all touching different parts of an elephant and trying to figure out what is this infodemic thing. I think we're definitely all tackling different parts, but in consolidation and trying as much as possible through these platforms to come together and understand, have visibility on what each of us is doing on their end is very helpful. I think it's extremely, I think again, like as everybody has mentioned, it's all about trust, it's all about transparency. People have the right to be scared, as simple as that, as Roberta had mentioned. And it's our job to make sure that they understand what does that entail, and to make an informed and a calculated decision based on the risk benefit that's out there. Vaccine misinformation is something that's definitely, as everybody mentioned, it's not something that's new, and in the African region specifically, especially, and you keep touching on the example of the polio vaccine. In Nigeria, for example, in northern Nigeria in 2003, there was an entire boycott in a number of northern states where they just banned the vaccine, which has set the eradication efforts for years back. Was a great setback for eradication efforts. It's also important that for us, I think one additional thing to add to all of this is that it's not just one person's choice, it's a collective choice. And vaccination is something that as a humankind, we would never be able to reach eradication of wild polio or smallpox if we hadn't been able to collectively work together and work on immunizing our children and all of that. It's going to be the exact same thing for COVID. Reaching herd immunity only happens through vaccination, and there is no other way around it. We will not miraculously get the virus and all of us will get herd immunity. That's a fallacy. It's just not true.
Roberta, if I can bring Roberta in, how can we, and just reiterating Halim's point that you know the answer is the community being part of the vaccine. How does the media and verified media, trustful media, and science work together to address the communities who might be scared of vaccines? How can we ensure that we're working as a team on that? Can you unmute yourself? I hope this is the Oxford word of the year, is unmute yourself.
I'm afraid that a prerequisite, I don't know if you have this word in English, is it okay, prerequisite?
Yes, it's the same word.
For all of this, is that decision maker, politician, scientists, before journalists, are well aware of this and are all very well aware of everything we've said this morning. I was very much impressed and let me say comfortable. I don't know if it's okay, because I had been working on 2 European projects before Quest about preparedness and communication in outbreaks. Tell Me project and Asset project. And for years, we've been working with these ideas that involvement of the citizens, engagement, and respect, trust was the key, these things. But when we come to the real communication that's going on, I mean, I see Italy, I don't know that I don't know if everywhere is the same, but in Italy, we have a very different communication, very paternalistic, very top-down communication, absolutely not consistent, as Melinda expressed, with one minister says one thing and the director of the National Institute of Health says another thing, and one scientist fights against the other. And this kind of communication that our journalists just transmit, just take, they interview these people and just amplify this communication without any filter. Because in Italy, we have a press that, I mean, we have very few scientific journalists in the key roles. We don't have. So the journalists, they just interview the experts, and they just let the experts say whatever they want without any critical approach. And I'm afraid that this is the key. We should have more scientific journalists when we deal with the scientific issues. And I really ask the WHO people who are here, you should address governments and institutions, the national institutions, stressing the importance of communication, because they, in words, they say, well, we know communication is important, but in fact, they absolutely ignore it and don't give importance to this. And I'm very worried. Now in Italy, we discuss about vaccines, discussion about compulsory vaccines. When people are so scared, if you talk about compulsory vaccines before the vaccines are even approved, is something that I think is very, very dangerous for hesitancy. And
Roberta, I think you highlight again this need for us as a community and living in the 21st century, and that we want to find solutions to this now. And the scientific method is just that. It's a method that has peer review. It takes time to do clinical trials, and all of this has happened very rapidly. I think there is hope, but again, it's about transparency and trust. And I know, you know, for the journalists and media people who are listening, you know, there are, you know, each of you has a science academy in your country. If you're a journalist and you're not sure because your newspaper doesn't have a specific expertise in that area, you can go to your National Academy of Science to get that expertise. And in fact, the next session that's happening this afternoon talks to exactly what Roberta has raised, which is how as a newsroom do we find ways to get science expertise that through to the disruption of the media institutes, we might no longer have a scientific reporter. Kritika, I want to give you one last go before we close the session. I'm interested to know how what change of behaviour was in your audience when you started bringing in verified information from the fact checkers. Did you find that your audience got bigger, and as more young people in particular trusted your news organisation when you started doing the fact checking?
Yeah, I think the fact that we definitely saw an increase in the number of queries that we were receiving from our audience, both on WhatsApp and on email, we really saw a spike. So I think that's definitely an indication that people are interested in verified information. People wanted to know what the truth is. And also, second indication that I would say was that all the fact checks that we've done around COVID-19, that we've done around, be it political COVID-19 fact checks, or be it related to health, vaccine and other fact checks, we've definitely seen an increase in the traffic as well, which again is an indication that people are interested in verified information.
Thank you, Kritika, and I think that's a key message, is that verified information and trust will build your audiences. Melinda, before we let you go, there's been a couple of questions from journalists on how they get access to the WHO. How do they get access to the daily briefings that take place? How do they ask questions? Is there a website or some tips that you can give so that people can actually go straight to the top and get information hot off the press?
Okay, I'll make this very easy. Yeah. Just email media inquiries with an I at who.int and ask us questions about how to get access to all of the press conferences, the transcripts after the press conferences. There's a rolling feed of new science and news, and we have updated information all the time.
Great. So can I ask our moderators to please put that in? So that was media inquiries at who.int, and you'll be able to.
Can I just say one last thing?
Yes, you can.
Participants, I just want to thank you for your time, number one, but also just to let you know how much we're really relying on you. We can't do this alone. We really, really need your partnership as the media now more than ever. Your role is super critical in all of this. You're part of the process. You're part of the solution. So thanks.
Thank you, Melinda. Halim, one last set of words before we head off.
Thank you so much for having me, and it's a real honor to be on this panel. And I think the key lesson from all the different discussions is just to work together and to collaborate to try and maybe just for a little while when it comes to reaching the facts behind this pandemic and trying to make things work, is to forget and put aside our competition as media organizations, as different agencies, and work together to achieve the greater good on this.
Thank you, Halim. I think unless Kritika or Roberta, you have anything final that you want to say.
I want to thank you, everybody, as well, and thank you especially for letting us know different experience. I very much appreciated Halim experience with viral facts. I think that we should try to know and try to copy each other with these things, because we are all together in this crisis, and any experience can be useful for everybody. So thank you very much, Halim, and thank you very much to everybody.
And Kritika, last words?
Thank you so much for having me on this panel. I'm truly honored to be on this panel with all the other panelists. And I think I couldn't agree more with everybody, what they've said. And the only thing I want to say is, in my opinion, really collaboration is the key, because that is the way how we can move forward, and we can really reach a wider audience and make sure that the information that reaches them is verified information. Yeah.
Well, thank you, everybody. It's been a pleasure to moderate this panel, and I think the key themes of collaboration, particularly international collaboration, to find solutions to these global challenges that we're facing. Trust, transparency are the key messages. If I can ask the World Editors Forum and WAN-IFRA to put some of Kritika's information into the chat box for the journalists, particularly on the fact checking, I think that would be an excellent addition to this discussion. And just a reminder that, again, if you don't have the scientific expertise at your media house, you can contact your National Science Academy and you can get the information from them, and that will be coming up in the next panel. Sherilyn, it's over to you. Thank you very much to the World Editors Forum.
Good, thank you, Alison. That was really great. It brings together the program. It was exactly what we wanted. It's the joining the dots between all the expertise and using that scale and weight to change both journalism and communication around science. So once again, just thank you to the panelists, and thank you very much to Alison for leading the conversation.
Thank you. It's
and
been
one
good.
final thank you to the our sponsors, Temasek Foundation, who share the spirit and need for joined up thinking around building a future.